Shaping New Jersey, the state partnership for nutrition, physical activity, and obesity prevention. What's our vision for New Jersey? We want to create a New Jersey where regular physical activity, good nutrition, and healthy weight are a part of everyone's life. We hope that through a shared vision by many, we can accomplish this in New Jersey. This is the first generation of children that are expected to live shorter lives than their parents. Obesity is truly becoming a national security issue. Making the healthy choice the easy choice is an uphill battle. In addition to the more traditional education approaches, ShapingNJ emphasizes policy and environmental change to support increased access and availability to healthy foods and to make physical activity choices easier for New Jersey residents. We can lower the effort it takes for each of us to eat healthy and be physically active by improving the environment in which people live. We are moving away from the traditional model of education for individuals to changing the environmental and increasing policy supports. While obesity has increased among all groups, its growth has been highest among children and minority groups. New Jersey has the highest rate in the nation in obesity among low-income children aged 2 to 5 years old. We are promoting healthy, active communities through policy and environmental change. We have built a robust and multi-sectoral public and private partnership of more than 180 organizations, including businesses, state departments and offices, hospitals, nonprofits, universities, national associations, philanthropies, and many more. And we are working with partners outside of health, such as transportation and the built environment. So here's our program. First, we had to find partners to work with us. Remember, this is a big job that we cannot do alone. So we found many other organizations whose work is somehow related to obesity to join our partnership. Second, our focus is on policy and environmental change. This is important, so I want to tell you what this means. This is different than what we used to do, which is tell people to eat more healthy and get more exercise. That by itself has not worked, and people just continue to get fatter. So now we are looking at changing the environment to make the healthy choice the easy choice. We are especially concerned about reaching people who are most at risk for obesity. Remember that this is some minorities and poor people, and our 2 to 5 year olds. There are some behaviors that are related to obesity, so the picture shows the behaviors as well as the direction in which we'd like to change them. Here's a picture of the kind of efforts, traditional efforts, that we have done in the past, such as health fairs and one-on-one education. And that alone, we know, aren't particularly effective. It's not because there's no value in doing them, but because it is not enough to address the complexities of obesity. Here is an example of bike lanes, which promote healthy physical activity. As I mentioned before, our work focuses on change in 5 settings: schools, childcare centers, communities, healthcare facilities, and work sites. We want to, in the community, put fruits and vegetables and other healthy foods and beverages within easy reach in all neighborhoods. We want to develop incentives for new food markets to locate in neighborhoods lacking access to healthy foods, and make it easier for convenience stores to sell healthy foods. In the community, we also want to increase safe and convenient opportunities for physical activity in parks, playgrounds, recreation centers, and other neighborhood settings. These are all geared toward making the community a much better, healthier place for people to live, work, and play. We also want to create community environments where people can safely and easily walk and bike to school, shops, transit, and other daily destinations. Doing so, we will adapt existing and build new streets and sidewalks to make it easier to walk or bike. In the healthcare setting, we want to promote exclusive breastfeeding through proven policies and practices. In particular, delivery sites should adopt the World Health Organization and UNICEF's 10 Steps for Successful Breastfeeding. In childcare, require childcare and after-school programs to provide healthy food and beverages and opportunities for physical activity and limit television viewing. We should revise licensing requirements for childcare and after-school programs to ensure the consumption of healthy foods and encourage physical activity and limit television viewing. In school, we want to support the efforts of schools to serve healthy and child-friendly meals and snacks. Increase meal reimbursement rates so that schools can purchase more fruits and vegetables and other nutrient-rich foods and beverages. In school, we need to strengthen state and local wellness policies and facilitate policy implementation and monitoring in every school through strong school wellness. We also want to involve all students in both physical education programs and other forms of physical activity throughout the school day. Physical education is a curriculum-based program that teaches skills for maintaining an active lifestyle, as well as providing time for physical activity. In the worksite, we want to increase the number of businesses that accommodate breastfeeding women. In addition, we want to promote health screenings, increased options for healthy food and physical activity, and weight loss counseling in the workplace, highlighting improvements in employee health and financial benefits for employers. In this way, we will disseminate model worksite wellness policies and programs to the business community. Be a part of the obesity solution. There are a variety of things everyone, either individually or through your organization, can do to join our efforts to prevent obesity. For one, prioritize obesity prevention in your work. Make the healthy choice the easy choice within your community and workplace. And don't forget to visit ShapingNJ.gov and sign up for the newsletter. Thank you for watching.